Hello everyone, and welcome back to my channel. My name is Makisa, and I am a licensed mental health counselor, as well as a certified marriage and family therapist. On this channel, you will receive weekly tips on mental health, relationships, as well as self-development. My goal is to motivate you, empower you, and inspire you to thrive while on your journey. Let's begin. On a previous video, we talked about the importance of nurturing your mental health as well as prioritizing your mental health. And the way that we do that is through advocacy. By advocating for our mental health, we are simply verbalizing our needs and making them known, making it plain. Sometimes there are barriers that may hinder us from advocating for ourselves, our mental health. One of the barriers is fear. Fear of receiving a label or a diagnosis, and fear of the unknown. Sometimes we think, well, if I receive a label or a diagnosis, people are going to judge me, there's going to be a stigma, and so that fear can prevent us from receiving the help that we may need. Another barrier is just not being used to talking about mental health. In a lot of families, mental health may be a taboo subject. It's just not something that's expressed in regular conversation. It's just not talked about. And so we need to begin the conversation regarding mental health so we can begin to advocate for ourselves and make it a safe place to advocate for our mental health. There are a few ways that we can advocate for ourselves. One of those ways is at work or through our place of employment. There are a lot of employers that offer mental health days, and those days are to be used to decompress from the stressors that may be present at work. While using your mental health day, that time is just a step away to relax, rejuvenate yourself. Whatever activity helps you to calm down or makes you feel relaxed, that's the time to engage in those activities and just recharge your mental battery. So using those mental health days that your employer may offer is very beneficial. Another way that we can advocate for ourselves is, within our families. Sometimes we're so busy and we take on so much at one time that it can be to our detriment. And so sometimes we need to learn to say no and know when our plate is full, can't take on anything else. So you have time to take care of your mental health and prioritize your mental health. Another way that we can advocate for our mental health is through professional means. That means seeking therapy, counseling, and or seeing a psychiatrist. The purpose of going to the therapist is to really get to the root cause. What is going on in your environment externally that may be contributing to the current mental health issues that you may be experiencing? Or it could be things that occurred in your past, childhood, that may now be resurfacing in your present day, and that's now contributing to your mental decline. And so seeking professional means is another way of advocating for yourself. Going to the psychiatrist is for medication management. The psychiatrist will perform an initial psychiatric evaluation and see if there is a need for medication. The psychiatrist's role is to make a recommendation, and based off of that recommendation, you decide what you do with that information. Just because you go to the psychiatrist doesn't necessarily mean that you will have to start taking medications. Again, they will make a recommendation and you decide what you do with that information. Their recommendation will be made off of your current presentation when you meet with a psychiatrist, as well as any information pertaining to your family history that you share with them. Sometimes just changing your routine, changing your environment may alleviate whatever mental health symptoms that you're having if they're mild. But if they're more moderate, then professional means may be needed to help to decrease those symptoms or alleviate those symptoms. One of the things that's important is I believe in a holistic approach. And again, that means talking to the therapist and or counselor as well as the psychiatrist for medication management. And so that's the best approach, a holistic approach. If you're taking medication but you're not getting counseling and getting to the root cause of what's causing the problems, you're not really addressing the problems in its entirety. At the same time, if you're going to counseling and therapy, but you're still having issues, you're still having a lot of symptoms, and you're not seeking guidance from the psychiatrist, again, you're not treating the symptoms in a holistic manner. One of the things that's important when you seek professional help is to build rapport. And by that, I mean you talk to the providers, you let them know what's going on, and you feel comfortable. If you don't feel comfortable talking to the therapist and or psychiatrist, then you're not going to want to advocate for yourself. You're not going to express what your needs are. So it's very important that you build rapport and you develop a good relationship with your providers, your therapists, and or your psychiatrists. Another thing that's important is keeping a record or log. This is so important because the providers will ask you questions about your history, what's going on currently, and sometimes it can be hard to remember those things in the moment. And so having that record or logbook can be very beneficial. It gives the providers insight regarding what's going on with your mental health. When you build rapport with the provider, they get to know you. They get to know when you are doing well mentally, and they get to know when you are at your baseline. Baseline basically means what is your regular normal behavior when you're in a good space, when you're doing well. And so when you have rapport with a regular provider and they get to know you, they also know when mentally you're declining, you're not in a good space. And so that's why it's so important having regular care with your counselor and your psychiatrist. Consistency is very important. On that record or logbook, there's a few key things that you want to keep in mind and include. You want to think about family history. Talk to your family members. Ask them, is there any family history of any type of mental health disorders or issues? A lot of times there's family members walking around that are undiagnosed and they're struggling. They go through life having a hard time, just not getting the help that they needed, suffering in silence because they're afraid to seek professional means and to seek professional help. So it's very important to ask about family history as it pertains to mental health. Also in your logbook, you want to include symptoms. What symptoms are you having? Are you having issues with your sleep or appetite, or are they decreased or increased? Is there any anger or irritability? Are you having any issues with your interpersonal relationships? Can't get along with others? Can't maintain relationships? No drive or motivation? No interest in activities that you once enjoyed? You don't have an interest in them anymore. There may be issues with your activities of daily living. That includes grooming yourself, your daily hygiene, things of that nature. Also, there may be issues on your job. You're less productive. You're having issues focusing or concentrating. You can't complete tasks. So those are just some symptoms that may be present that you want to include and write down in your logbook. You want to also write down the onset. When did these symptoms begin? How long have they been going on? You want to include the frequency. How often are you having these symptoms? Are they every day? Are they a couple times a week or a couple times a month? Are those symptoms continuous? Is there a break or reprieve in the symptoms, or are they constantly happening or going on? How intense? So the intensity of the symptoms. On a scale of 1 to 5, 1 being very mild, 5 being they're extremely intense. How intense are your symptoms, something else that you want to include in that record book. You also want to include, how have you thus far been managing those symptoms? What have you been doing? Are you using any natural remedies? Have you been coping with drugs or alcohol? Those are things that your providers will need to know and they will ask about. Also, it needs to be included, are there any medical conditions that's going on or taking place? Sometimes medical issues can contribute to mental health decline or mental distress. So it's very important that you notate in your record book if you have any medical conditions. The other thing that you want to include is medications. Are you taking any current mental health or medications for medical conditions? That needs to be included in your record book. When you go to your initial appointment, it's important to take your medications with you. That way the providers can see what you're taking, how long you've been taking them, what are they for. And again, all of this information will help the psychiatrist arrive at a proper diagnosis as well as a treatment plan. And so that is the importance of having the record or logbook. It really helps you to advocate for your mental health. And so I encourage you just to utilize this record or logbook on a regular basis. It can make your life a whole lot easier in terms of managing your mental health. So you may say to yourself, mentally, I'm doing well. That's awesome if that's the case for you. But at any time, our mental health may be compromised depending on what's going on in our homes and also in our environment. And so one of the ways that we maintain good mental health is just doing a check-in with ourselves just to see how we're doing and utilizing that record or logbook on a regular basis. If after you see the psychiatrist, they prescribe medication and you start taking the meds, you want to record in your record or logbook, how are you responding to the medications? How is it making you feel? Are you having any side effects? Keep in mind that with any medications, there's side effects. When the doctor makes a recommendation, they are looking at, by taking this medication, does the outcome or the benefits outweigh the risk involved? So that's what they're looking at. And so when you take the meds, you want to notate in your record book, are there any side effects? You want to notate when you started taking the medication. And again, how did it make you feel? The goal is not for you to feel like a zombie. The goal is for you to be productive while reducing any symptoms that you may be having. You want to be able to function while taking your meds. So that's not the case. Don't just stop taking the medication. Have a conversation with your psychiatrist. Talk to them. A good psychiatrist is going to hear what you have to say. They're going to listen to you. And if the medication is not benefiting you, you're going to go back to the drawing board and see, okay, let's change the dosage, or we may need to try something else altogether. One thing to remember is that you have to give the medication time to work. If you are not taking the medication as prescribed, the medication cannot work as it is intended to work. So with medications, they have to be taken consistently, and they have to be at a consistent level in your system over time in order for it to work the way that it's intended to work. So if you stop and start taking the meds, or you're not taking the correct dosage, it's not going to work properly. Something else to remember is if you start taking meds, it's not wise to stop taking them abruptly, because it may cause adverse side effects depending on what the medicine is. So if you decide, the medicine is not for me, I'm not feeling this meds, very important to, again, advocate for yourself and have that conversation with your psychiatrist, or your doctor, your provider, and let them slowly wean you off the medication safely and slowly. If you feel like you're not getting the care that you need, don't be afraid to seek a second or third opinion, again, from a provider that you feel like you have a good rapport with. The whole goal is to advocate for yourself. So to have providers that you feel like you're comfortable expressing your needs, and you're receiving quality care and you are getting your needs met. So we have wrapped up this video for today. Some tips to keep in mind when advocating for yourself is to keep a record or a logbook. In that logbook, you want to include the symptoms you are having. You also want to include any family history information as it pertains to mental health. You also want to have in that record or logbook the onset, the frequency, and the intensity of the symptoms that you may be having. You want to have in that record or logbook any medical conditions that you may be having, as well as any medications that you have taken in the past or any current medications that you are taking. When you go to your initial visit, go ahead and take your medications with you so the doctor can see what it is that you've been taking. Thank you so much for joining me and watching my video. If this video has benefited you at all, go ahead and do me a favor. Go ahead and hit that like button and subscribe to my channel. Until next time, be well and take care of yourself. Thank you.